Dan Jackson, over to you. Yeah.
Bismillah ar-Rahman ar-Rahim.
Sorry, before you start, correct my mistake on your way, please. In my presentation.
Okay, Assalamu alaikum wa rahmatullahi wa barakatuhu. It's a great honor to be here. Dr. Pham and his family have helped me a lot over the years, and I'm sure a lot of you guys as well. So special place in my heart for this place and for the family. So there's quite a wide topic, really. I'm not sure how to kind of to think about this. Initially, when Dr. Pham asked me to do this speech, I did a presentation with regards to adolescence within Islam, so thinking about it from an Islamic point of view. But I know Ustad Talha is going to be talking about that, so I'll kind of backtrack a little bit and talk more about the clinical aspects of dealing with adolescence and my experience in that. And if there's specific questions about how we might address that from an Islamic point of view, then I'm happy to go into that, but I'll leave that for Talha, inshallah. So in terms of how we look at mental health problems from a psychiatric or medical point of view, it's a little bit different when we're thinking about children and adolescents to adults. So children and adolescents, obviously because they're developing, right? So the brain's developing, their ego's developing, their identity's developing, their systemic understanding's developing. So all of this you have to take into kind of consideration. It's not set. Personality is kind of progressing. So you've got to be aware of the different milestones and aware of the different ages. But in terms of, if we think about it in clinical problems, because all teenagers are pretty problematic. I don't think there's any teenagers, and that's how they have to be. They have to be oppositional. They have to test their ground. You know, as adults, we forget that we've had many, many years of experience of living life, and actually they're pretty fresh into it, and we don't give them the benefit of the doubt. But that's what they're trying to do. They're trying to push against us. And even physiologically, you know, their whole sleep system changes. They naturally sleep later in the nighttime, and they naturally wake up later. You know, we always kind of give them a hard time for that, right? You go to bed too late and sleeping in, wasting your time, and you need to be up in 8 o'clock in the morning on a Saturday morning. But actually, physiologically, this is what happens. And thinking from a practical point of view, when you're trying to separate from your parents, because this is what they have to do. They have to learn how to be adults. They have to learn how to go into the world. They need some time by themselves to be able to develop. And so if they're around the family all the time, how do they do that? So sleep naturally changes for adolescents. So some things will be absolutely normal, but still difficult. It doesn't take away from the difficult aspect of raising children and raising teenagers. But when does it, like Dr. Hanan was saying, when does it become medical? When does it become clinical? And that you need support maybe around that. So I guess that's what I'll be touching on in this short presentation. So the way that we look at in child psychiatry is problems or syndromes kind of split into neurodevelopmental. So this is things like autism, ADHD, tic syndrome, schizophrenia in young people, as Dr. Pham said, very, very rare, but if it does happen, this tends to be a developmental difficulty, things like learning disabilities, communication problems. Then we have the emotional side of things, so whether it's depression, anxiety, OCD, PTSD, these kind of diagnoses will come under emotional problems within young people. Then this is the controversial one, is behavioral. So we have certain diagnoses within psychiatry, such as oppositional defiance disorder, conduct disorder, right? So people just being oppositional. Now, all teenagers clearly are going to have some sort of oppositional aspect to them. But when does it become a clinical problem? Is it a clinical problem, or is it just a really naughty kid? Right? How do we frame that? And it's really difficult as parents, isn't it? Are they being just really annoying? Or is there a problem? Is there an emotional problem? Is there a behavioral problem? And then the other kind of category is we're seeing more and more somatic problems. So psychological problems becoming very physical. I'm speaking to some of my pediatric colleagues. Probably half of their clinics now are medically unexplained symptoms. So emotional, psychological problems coming out as physical health problems, and they're seeing lots of that. It's taking up their clinics. Eating disorders is on a very, very high numbers now being referred in for eating problems, gender identity problems, gender dysphoria, etc., and somatoform problems. So these are kind of the four main sort of categories that we tend to deal with in children's mental health. So if we're having difficulties with our adolescents, is it a mental health problem? So I've kind of taken it back a little bit conceptually to try and help you guys and myself understand when that might be an issue. So all psychiatric problems pretty much are kind of continuums, so scales of things. So depression, for example, there are some people who are mildly depressed, some people are moderately depressed, severely depressed. You're not just depressed or not depressed. Depression comes in many, many different forms and presentations. And it's a constellation of symptoms. So it's not like you can't really do a blood test for depression. There might be a blood test which suggests that your vitamin D is low, or your hemoglobin's low, or your thyroid's underactive, or something like that, which might be a factor causing or helping cause the depression. But we don't have a blood test that says you are depressed. And so it's a constellation of symptoms which is across cultures, across peoples, etc. So pervasive lowness of mood, lack of enjoyment in things, lethargy, negative thinking, and so the clinician works out, puts all that together and says this pattern fits in with depression. So that's something to bear in mind because it's a clinical diagnosis. It's not always clear cut in terms of whether someone's suffering from a mental health problem or not. We have the normative curve model, which is the Lendl, the Kendall model that most people are within that normative curve. I think it's 2.5% on each of the sides. If you're within that, then you're outside the normal range of people. So, 95% of people experience life with this level of happiness. Those 5% are outside of the norm. Therefore, they're abnormal or they've got a psychiatric problem. That's how some people see sort of mental illness. Some people see it as a model of distress. So if it's causing you problems, if you're feeling upset by something, if you're distressed by something to a certain level, then it's an illness or a mental health problem. And you can extrapolate this to physical health problems, right? So a lot of us, everybody has some sort of physical health problem underlying. There are cancerous cells that come up, the body fights them, they get rid of them. H. pylori can exist in you. So you might have a lesion or you might have a bug in you or something like that, but it's not causing you to be ill. It's not causing you a sickness. So therefore, what is that sickness then? That sickness is some sort of distress. Or what my favorite model of illness and mental illness in particular is the loss of ordinary function. So you were functioning at a certain level. Your teenager was functioning at a certain level. So if they're an A-star student and they have problems in their life and they suddenly become a C or D student, that's a problem. And you as a parent start looking into that. If they were a C or D student and that was their academic abilities and they continue at that level, you don't start to seek help for that because there's no change in their function. And this, if you look at the Sahaba radiallahu anhum, some of them would go and seek medical attention for things. Some of them wouldn't. Like Sayyidina Abu Bakr never sought medical input for any ailments, any problems. They saw as a lack of ordinary function, which they could make dua to Allah subhanahu wa ta'ala and go through those hoops of doing it themselves. So there's a level of acceptability, and once that level of acceptability comes out, then potentially the illness or the problem becomes better. And then there's a group of people who think mental illness does not exist at all, like Thomas Sars, for example, the anti-psychiatrist who said that actually no such thing as mental health. This is the problems of living, problems of social interaction, right? It's just how we frame things. So I hope I'm not going too deep into things, but it's I think it's really useful because this mental health is talked about all the time, isn't it? Social media, our teenagers are talking about it all the time, and some people this word "I'm depressed" or self-harm, all of these kind of terms. Has someone got anxiety or not? It's really useful to pedal back and to think about, well, what do you mean by all those sorts of terms? And what is, if someone's mentally unwell, what does that mean? Because actually a lot of us working in the profession don't necessarily have a clear idea of what functions as mental illness and what doesn't. So, developmental considerations. So when we're thinking about adolescent mental health, as I said, we're talking about development. So something that happens for a 4-year-old is different if they happen when they're a 10-year-old. So basic bodily functions, for example, if a 4-year-old comes to clinic and the mum says, oh, they're soiling themselves, they're wetting themselves, it's not really a concern. They bring their 10 or 11-year-old to the clinic and they're soiling themselves, then there's some sort of problem going on there. There's something which needs some investigation. So this is the importance of child and adolescent mental health, is that you should have knowledge of general development. So this is just a slide that I had for some of my trainees, but I thought I'd put it in because I think it's important that we reflect on what's normal and what's normal. Some of us have very high functioning kids. Some of us don't, so we have skewed kind of ideation of what our children should be able to do at the different levels. And so some people get hyper worried about their children not reaching certain levels of attainment. Some people really miss what they should be doing. So some basic knowledge for us as parents of motor development, like that's why on the red books you get with the children's, right? When are they sitting up on a hard surface? When can they walk? Right, so there's things that we check off. We should be thinking about that in emotional development as well. How do they interact with people? How many words should they have? What's the social reciprocity for that young person? Is it okay for their age? Is it not okay for their age? Is it within normal kind of personality, or is it something which is a bit skewed? So we'll go into adolescence, but let's just have a think about leading up to that, because actually this is the most important time. The most important time in terms of development is in utero. Right? And then after that, it's the first year, then the second year, then the third year. People think like 1-year-olds, they don't remember anything. They don't pick up on anything. This is the year of basic trust versus mistrust. So let's make it a bit more interactive then. So what happens in this first year? What should this baby be doing? Sleeping a lot, yeah. Because the brain as it doubles in the first year, I think. So there's all that neuronal growth that's happening with the young person.
Interacting with the parents, playing, reading.
When's the first smile? When should that happen by?
6 weeks.
6 weeks.
So they say, but now it's happening earlier.
Yeah, so the first smile should happen by 6 weeks. That's a social smile. So it shouldn't just be a bit of wind. Right, the mum's saying a smile and all the relatives are going, no, she's just got wind. And that's so important, right? Because the mum's just gone through labour, probably got some postpartum blues, feeling pretty stressed with the whole situation, and then the baby smiles at them and everything's much better. But yeah, that interaction, that cooing back and forth is really important. And this is the time of attachment. Yes, you hear a lot of this in the psychology fields, the psychiatric fields of attachment disorder. This is really where attachment happens. So the baby attaching to the primary caregiver and the primary caregiver bonding to the young person. So I worked in a mother and babies unit for a while up in Birmingham. And even with severely unwell ladies, right, people who are floridly psychotic, they would try and keep the baby with the mother for as long as possible. If there was no bonding that happened after about a month or so, then they would identify another primary caregiver, whether that was the dad or the grandmother or what have you, and they'd make sure that baby bonded with that person. But as much as possible, they would keep the baby with the mum, because it's just hugely important. We know if there's attachment problems in that first year, the possibilities of things like mental health problems, personality disorders, etc., it just skyrockets when the baby is older. We know if the mum has depression, anxiety during the pregnancy, a massive increase of depression and anxiety in middle childhood and later childhood for the young person. So year 2, what sort of things should this little one be doing by now? Yeah, walking. Yeah, they should be walking by 18 months, shouldn't they? Anything else?
Eating terrible.
Tantrums. Yeah. Why do they tantrum?
They're discovering their personality. They understand more.
Yeah, and they're trying to get their
They're trying to
autonomy.
explore the why becoming the balance.
Exactly. So this is exploration with a secure base. So you're exploring the world. You're figuring out what you can do by yourself, and you're looking back over your shoulder, making sure that your mum or dad or whoever's is there. Yeah, you get these very rare kids that kind of are not bothered at all about secure base, and they're just, the great adventurers of the world. But most people will have that push and pull with their parent. They want to do things by themselves. I want to do it by myself, and the parents sort of holding them back and letting them play and having that risk taking. Okay, age 2 to 5. What should be happening? Think about all sorts of development. Don't worry about physical development.
Someone said language acquisition at age 2 already.
Mm-hmm. What should they be? How should their language be at sort of 2 to 5?
It's getting quite rapidly sort of increasing.
Yeah.
In terms of vocabulary and
other conversations,
conversations.
When should they have sort of fluency of speech?
Well, that could vary quite a lot with a few different children. But if you didn't get it towards the end of say 5, then maybe that would be concerning. But there's probably a spectrum thing.
Yes.
What I find is that the younger children, they tend to pick up vocabulary a lot more in conversation at the age of 2. It's like the interactions with older siblings that tend to get more engaged and they pick up a lot more vocabulary at that younger age.
Yeah.
So even by the age of 2, they can have a conversation and add them.
Yeah, they pick up a lot. So at 2, it's quite concrete thinking. So if they can see something, if they can hear something, it exists. If they can't, then it doesn't. That's why peekaboo works really, really well. Right? You go under the sofa, you pop back up, they laugh, you pop back down, pop back up. It's like you've done it for the first time because they're so concrete in their thinking. After 3, 4, 5, they're starting to have that theory of mind, realize that there's some experience in the world other than what I'm experiencing right now, and they start to think about kind of communication with other people. Anything else during this age group? Friendship is really important, yeah. And if they don't have friends, they often have fantasy friends, right? So I get referrals, my 4-year-old or my 5-year-old is psychotic, they're talking to someone or they're seeing things, and it's very, I've never seen psychosis in that age. It's usually about fantasy worlds, and so their imagination is so good that it becomes like sort of almost hallucinatory. Yeah, pretend play is really important for them.
If you drop them at nursery or school or whatever, and if they're always crying, they don't want to go there. What do you make sense? How do you make sense of that? There are others who go in quite happily, but some of them don't want to leave their mom at all, or just want to be attached with them all the time.
If it's severe, then it might be some separation anxiety for whatever reason, and that can happen for a whole host of reasons that you'd have to explore. But this is, that's a normal kind of attachment if they're a bit upset about leaving the primary care group. You'd be upset if you, on the first day of nursery, they never looked back and they just went straight into the room and didn't get a little bit worried, But if it's a year on and they're still holding onto your leg, not going into the nursery, then that needs to be worked through.
Well, the nursery could be quite.
Oh yeah, there's something going on in that nursery. Yeah. Good. Okay. And then, so middle childhood, so say from age 5 to 10, this is sort of so Erikson's work is really useful. In sort of child development, we're still using quite old material, so Piaget and Erikson and Freud and Klein and these kind of people. It hasn't really developed much further, but Erikson's it's a fantastic kind of model for looking at general development, emotional development, cognitive development in young people. So this is the kind of industry versus inferiority age for young people. So what can they get done in the world? What can they achieve? And this is why confidence is so important. Just pre-adolescence is just achievement, success, positivity. Like there's that study, wasn't there, that people who are top of their class in, say, a mediocre school, even though they're not as bright maybe as middle of the way in a very academic school, will do much better in life. Because that feeling of success and confidence in that early childhood is important to set them up for the rest of their life. So this is the industry versus inferiority kind of complex that happens at middle childhood. So each stage is really important. For adolescence then, what's important in terms of the adolescence?
I wanted to ask a question regarding the developmental milestone. Can I ask?
Okay.
Yeah. So, whatever is mentioned already as it has been mapped out as developmental milestones regarding, as you said, emotional behavior and physical. Do they change as well to the exposure the child is in the environment? Because that's what we are hearing quite a lot, that they are growing up in a different environment. So does it clinically affect us in regard to developmental milestones as well? Is there any
Yes, I mean, it can freeze. Yes, you're absolutely right. It can freeze the development at certain points. So like physical development can be frozen at certain points. Say if you're malnourished, or you're locked in a dark room for months on end, or what have you, that there's an arresting of development. Same in emotional development. That's why, attachment problems go on into adulthood. You see this in terms of their relationships, in terms of substance use, in terms of their chaotic behaviors. And you have to reattach. You have to go through that attachment process with them in a therapeutic way. Otherwise, that's why, we all act like children in certain ways. Our childhood was so important that it reflects what we do right now and how we experience the world. If we had resolution over certain things, then alhamdulillah, we move on and we accept that. People who haven't come through that resolution or that attachment, they will be arrested in that in that sort of personality development. So yeah, 100%, your upbringing can change the milestones. So yeah, adolescence then. What's important about this part? So that I felt it was important to go through the development to think about our adolescents, our teenagers. So what sort of things are they developing, and what are the problems that can happen?
Hormonal changes.
Yeah, this is really big, isn't it? Hormonal changes. Puberty is happening, right? The sexual awakening of a young person. Social network. This is all about your existence outside the family home. You realize you are going to be leaving the family. That's quite scary for a young person. You're going to be leaving the family at a certain point. You have to develop relationships outside the family home. That's why as parents we always get really annoyed that your son or daughter is spending so much time with their friends and they don't care about the family and this and that. But we also have to realize that isn't a natural progression, and they need to do that to move forwards.
Peer pressure.
Yeah. Yeah. I don't know if you'd open the Pandora's box of social media right now, but I mean it's massive, isn't it, in terms of peer pressure, just sort of worldwide now. Peer pressure. You can't do anything wrong without it being on the internet. You can't make mistakes anymore, which is really problematic for young people, to not be able to make mistakes, resolve them, make tawbah, move on, etc. That's really problematic for young people.
In this country.
Sorry, I'm a secondary school teacher, and I've noticed now since the pandemic that in a classroom there's quite a proportion of children that have gender identity issues. Sometimes like 10 kids in a class, or that's 7 or 8. And that's quite a lot, isn't it? That they're transitioning, or they're identifying as like there was one child that was even identifying as a cat. Is that a common problem? Is that since the virus that because of the virus that's affected teenagers?
Definitely, gender identity issues has been massively on the increase since the pandemic. That's a fact. Whether it's anything to do with the virus itself, Allahu A'lam. But true gender dysphoria, though, is still quite rare. And I see a lot of gender identity or misidentity or difficulties, and it's more of a general identity crisis. A general rather than gender. It's a general idea, because this is the time of identity development, is in your adolescent period. So if there's any problems within that stage, there will be a knock-on effect. So there's so many people who go down the gender identity aspect because they've got issues with their identity, and it gives them a pathway to think about, because there's some confusion there. True gender dysphoria, though, so from a very early age, from this age of sort of 5-6 years old, where they feel they're in the body of a male or a female, the opposite to what they are physiologically, and they continue to feel like that with great levels of distress. That I've seen that, but it's very rare. compared to what's happening now as a general difficulty with identity, which quite often gets expressed as, well, maybe that means I'm in the wrong gender. If that makes sense. But yeah, we're seeing a lot of that in clinics.
Is there an element of people jumping on the bandwagon on those sort of things?
Yeah, you mean like young people who, I'm sure that you have other young people. There's a whole sorts of opens up a whole sort of discussion around gender identity. But yes, if you've got 6, 7, 8 people in your class who are transitioning to a different gender, and potentially there's focus on that, it's causing disruption. It's causing a lot of sort of support for those people as well to be treated differently. There's lots of secondary reasons why that might come into.
Just going on what you were saying, like it being very rare. When you look at the media, you think, well, it seems to be quite overinflated then by the sound of it.
There's a lot. I mean, look, yeah, this is like a lot of psychiatric issues. Our diagnoses are affected by politics. So sexuality, for example, homosexuality was in the DSM, in our psychiatric kind of manual, till around the 40s or 50s. Alcohol was kind of swapped from being a moral problem to a social problem to a medical problem, depending on how the politics is around the situation. So gender identity is very, very political at the moment. There are a subset of people that really, really struggle with that, and they do need support. But yes, I mean, there's a lot that socially and in the education system that kind of conflates it or adds to the problem. So it's a big problem. The numbers are really problematic at the moment. And I say problematic because obviously that's political. People say, well, should it be a problem? Right? You should be able to express whatever gender you want to. However, we know that from a psychiatric point of view, if there is a gender difficulty, that leads to, or it coexists with at least, higher rates of things like depression, anxiety, emotional distress. So that is a problem within itself, if that makes sense. I knew gender would come up today. Okay, so this is Ericsson's table here, so definitely worth to have a look at. I thought I'd just put in a slide about young people since COVID, because we're still coming out of COVID, and we are seeing a pandemic of mental health problems after a pandemic. So when Dr. Panan was saying, well, I went into psychiatry to give me more time, I did originally, and now our referral rates are like 800% more than they've ever been. And the pandemic had a massive, kick-on effect with that. So in 75% of young people found the second lockdown. This is the problem, was there was a lockdown, kids are resilient, humans are resilient, but when there's a repeated trauma, then that's much harder to recover from. And so 75% of young people found the second lockdown especially much more difficult. 67% of people believe that the pandemic is going to have a long-term negative effect on their mental health. This is on the Young Minds website. 54% of young people up until the age of 17 had some sort of support for their mental health, either through a school counsellor or through a mental health service or psychiatrist, etc. That's half of our kids are being seen professionally. Why was it so impacting? This was a very large study. Mainly it was about loneliness or isolation, just again showing how much of a social creature we are as human beings. Concerns about school and college, not being able to do activities, concerns about someone getting ill, a high prevalence of anxiety around health issues, not being able to get support, relationships with people within the home, right? That becomes a lot more intensified. Anyway, you can look through that. One thing that parents will get really, really distressed about is the self-harm and suicidality, which is, if we think now that 24% of our young people self-harmed or attempted suicide between 2018 to 2019. So that's a quarter of all young people self-harming. That's a big portion of our population. It's very distressing as a parent to see that happen with their child. Happens for all sorts of reasons, and if we have time, we can go into those sorts of things. But Suicide is the leading cause of death for young people, so under the age of 34. In 17 to 19-year-olds, 50% have self-harmed or we've said that. And then, just an anecdotal thing, I work in London, and our referral rate for eating disorders, for example, has gone up by 10-fold. So it's coming out in different ways, but self-harm and eating problems definitely have escalated a lot. Gosh, after all that dreariness and negativity, on a positive note, alhamdulillah, young people are extremely resilient and adaptable. And, living in, say, a place like England, alhamdulillah, we're not having to think about trauma such as like war and, immigration and all this kind of thing that, we do see it. Obviously, a lot of us coming from different countries, for parents, etc. Dr. Ghanam, with his connection with Syria, seeing all the young people that are coming from very, very, very traumatic places, our young people are not dealing with those sorts of levels of trauma, alhamdulillah. So we're looking at the sort of the finer refinement of their mental health. So we need to not beat ourselves up too much as parents. The Winnicott kind of model of just good enough. If you're a secure base and you're looking after your child and you have the best interests at heart, sometimes that's really important to keep in mind, so you don't feel so guilty about your parenting styles. And also things can develop, like even as an adult, fully fledged adult with attachment problems, you can put in that therapy, you can put in that support for that person, and things can get better. So that's something just to bear in mind. And that can come in, I've 5 minutes, so yeah, I won't go into details because it's very individual on what that young person might need. A very good formulation, though, of what they need is the most important thing. So what's happening right now, why has it happened, and what are the things that are going to get that young person feeling better? To have that from the outset. Otherwise, you'll be getting a course of CBT, or sending them to a nutritionist, or sending them straight to the psychiatrist, or whatever it is, when actually you haven't got a real good understanding of what's happening to that young person. Speak to the young person as well is really important, right? We make dua for them, but you do have to speak to them as well. So sitting with them and allowing them to process it, allowing them to speak about their day. A very nice tip that I was given by a therapist was not to ever use questions with young people, to always use statements. Okay, so asking them, are they upset? Asking them, are they depressed? Asking them if they self-harm, right? All of these things, it means that you're putting them on the spot. So they have to give you an answer. And that's quite stressful because they can only say yes or no, right? If I ask you guys, do you self-harm? It's like, suddenly, right? It's like it's a yes or no situation. And that's how the young person feels, even if you say it in the nicest way. But if you kind of use statements, I'm wondering if, this happens a lot. You seem like this, right? These kind of statements rather than questions, it just opens up so much more for the young person. So anyway, that's kind of a ending tip. I know that's very clinical, and we are Muslims kind of considering our young people from an Islamic point of view, but hopefully Steve Talha will talk more about that. But if you want me to also talk about that in a bit, that's fine.
Please talk about it.
that's a whole different. Do you want me to? I don't know.
I'd love to hear your thoughts on it.
Just a quick question.
I don't want to take your time.
Sorry,
Are we doing questions, or up to you, Dr. Benham?
If you want to talk about the Islamic from, I said you can talk on both in the Islamic setting.
But if I run out of time, am I out of time, or?
Yeah, we will share the time with Dr.
Yeah, it's fine. You go ahead.
Why don't you?
Both.
I don't want to take your time.
I don't mind. I'm actually very interested in what you have to say. So, but it's up to you if you have something to share.
Okay.
I'd love you to talk about it, please.
Okay. Well, look, just some thoughts then, in terms of adolescence as a concept in Islam, and Talha, if you can build on this or see how you get on. So we talked about children and adolescence. Now, adolescence in Islam, does that even exist as a term? And the problem with that is that being mukallaf, being responsible in the eyes of Allah subhanahu wa ta'ala for our actions, comes when? At puberty, which is the beginning of adolescence, right? So that's really important in our deen, that suddenly a young person becomes responsible for their actions, okay? And so the non-acceptance of that, prolonging childhood, if you like, and we do that very much so with our young people, is that we extend their childhood in not taking responsibility for themselves or in the household, not giving them boundaries, not giving them freedom. So we do it to ourselves, to our own children as well. We want them to be responsible, yet we don't give them responsibilities. We want them to show initiative, but we don't train them to have initiative. So this is the problem that we have as Muslims, is that we fall into the traps of prolonging childhood, but we want too much for the young person. Does that make sense? We want them to do all these things responsibly. We want them to, to pray their prayers, etc. But then we also treat them like children. And we don't give them the respect as adults, yet we want them to respect us as adults. Does that make sense? So if you can't say that they're an adult in Islam, but then a childhood outside of the house, so that you treat them different at different times, it causes an absolute schism within our young people. Am I an adult? Am I not an adult? You treat me like an adult sometimes and not like other times. And that happens with all households and all families. But specifically, it does happen in religious families, Jewish houses as well, because they see their children mature at the age of puberty. But if we're going to treat our adolescents as adults, responsible in the eyes of Allah subhanahu wa ta'ala, then we also have to think about how we deal with the children. So the problems with that lack of acceptance responsibility is leaving deen till later in the life, right? I will put on the headscarf when I'm, later on in life. I will do my prayers later on, when I'm an adult, when actually puberty is the adulthood. So physiologically, they're an adult as well. That's really important. They can have children. Yeah, a teenager can have children. It's only since the introduction of contraception that there's flexibility around sexual relationships without having children. That's only happened over the last 60 years or so. And so that's changed the whole way. So you can prolong childhood because of contraception, because otherwise responsibility is automatically, someone gets pregnant, that responsibility is massive on that person's body, on that person's ability to support that child, on the system. There's a whole big effect that happens, whereas now it doesn't necessarily have that same effect. So there's a lack of acknowledgement of what adulthood entails and lack of respect shown to others and to themselves. So this is Robert Einstein's book that Sheikh Hamza mentioned about adolescence being sort of a made-up part of the development of a young person. And he talks about Mary giving birth to Jesus at the age of 13, and how the prophets a lot of them were very young when they did amazing things within the world, etc. The canon law allowed anyone 13 and over to marry, and then raised it from 14 to 16. This was until 1917. So again, we're talking about a very quick reframing of this age group that's happened. If we think of how the Prophet ﷺ treated adolescents, he generally treated them in a very adult way, right? So if we think of Abdullah ibn Umar, Abdullah ibn Abbas, they were invited into their circles of knowledge and discussions, the shura that they had with the Muhajirin and Ansar. They were there and they would be asked questions. They would be part of their opinions would be given weight. However, there was a differentiation between them and the seniors of the Muhajirin and Ansar. So the Prophet did make a differentiation, but he showed that these people are now adults and they should be treated as adults. Sayyidina Usama ibn Zayd, how old was he when he led the army? 17, 18, very, very young, when he was given the flag bearer to lead the army into battle. Obviously, that this is when the Prophet ﷺ passed away, and he was on the way to fight. He came back, and later on, was given again the flag to go, and he opened up the lands there. So that was Sayyidina Osama at the age of 17, 18. So there's this importance of treating them with respect, treating them like adults, but obviously having that respect for people who are older. And also understanding that this is a time of transition. So there's an increase in time and desire, like we've said, the sexual desires are awakening. There's impulsivity. Dr. Khanam was talking about the frontal lobe is the last part of the brain to fully develop. So you've got a fully developed body, a fully developed brain, except for the part of the brain which gives you disinhibition, which gives you executive functioning, which is about concentration. So in adolescence, we've got this real kind of cocktail of time where you've got a young person who may have mental health problems, who's got identity issues, who has an underdeveloped frontal lobe. You throw in substance use into that, you throw in problems at school or bullying, it's a really, really difficult time for the young person. Again, just ending with a positive note though as well, it's a time of immense reward from Allah subhanahu wa ta'ala. This is why the Shab al-Nasha'a fi ibadatillah is one of the 7 categories that will be under the shade of Allah subhanahu wa ta'ala on that day. The young person that is brought up in the worship of Allah subhanahu wa ta'ala. Yeah, this great hadith here, that ajaba rabbuka min shabin la sabuwata lah. Allah subhanahu wa ta'ala is bewildered by the young person who doesn't have a childness about them. Yeah, this kind of this foolish childness about them. That there's a maturity to them. You don't see this very kind of rare examples. Talha and Marwan and his brothers, etc., and his sister. These are great examples of people. Really, I'm not just doing to flatter them because I'm here, but great examples of young people who were brought up in the worship of Allah subhanahu wa ta'ala, and that Allah subhanahu wa ta'ala is marveled by these kind of people, because it's not normal. It's not, no offense, but it's not normal in a very good way. It's not normal. Young people want to play and they want to mess around and they want to get into relationships.
And you have been an example as well.
Astaghfirullah. No, I just, I make tawbah to Allah subhanahu wa ta'ala, but we've had good examples around us. But yeah, this is a time of immense reward. That's why if your teenagers do good things, we should be really positive and reaffirm that. And be really thankful to Allah subhanahu wa ta'ala that those things are happening. So I've rushed through that because I want to give you some time.
If you go to
no, I'm just checking if the app is there.
PowerPoint, recent.
No, you don't have the app. I'll do it on mine though.